new artificial intelligence tool could help warn doctors when their patients are at risk of suicide. A study tested an AI system that analyzes electronic health records and pinpoints patients at higher risk of death from suicide within 30 days. The system then prompts doctors to ask patients screening questions. The system flagged about 8% of patients for additional screening and support. Suicide remains a leading cause of death in the U.S. A new study finds nursing home residents with Alzheimer's or dementia face more unnecessary hospital visits than other patients. Researchers say these transfers often cause confusion and stress when care could be provided at home. The challenge is many patients with dementia struggle to express their treatment preferences. After a relatively slow start to respiratory virus season, the U.S. is kicking off 2025 with a surge in several illnesses: the flu, RSV, and COVID. Stephanie Stahl has the latest.
It's a new year, and we're starting 2025 with the same old respiratory viruses. 40 states, New York City and D.C., are reporting high or very high levels of flu activity, according to the latest CDC data. Emergency department visits for RSV and flu are very high and are increasing for COVID-19 from low levels nationally.
I thought it was a sinus infection. I had no idea.
Pam McLaughlin went to urgent care with postnasal drip and a strange burning sensation in her nose.
The doctor came. She said, "I'm shaking my head because you got a double whammy. You have COVID and the flu."
Doctors say some people have built up immunities from previous infections and vaccinations, which can make symptoms milder. But there's also a growing number of people with serious complications.
And over the last week, it started reflecting in our hospitalizations and admissions, where it starts to become challenging to our staff.
Dr. Martin Topiel with Virtua Health says RSV, another respiratory illness, is also spiking. All the contagious infections probably related to holiday gatherings when people are in close contact. Do you expect this increase to continue now post-holidays?
Yeah, I think the next 3 to 4 weeks may be very difficult.
He says infections are being spread quickly by many people who don't realize they're contagious.
Be careful. The slightest thing, just go get tested. It's better to be safer than sorry.
And doctors say it's not too late. Vaccines are still available for COVID and flu for everyone, RSV for people at high risk. I'm Stephanie Stahl, CBS News, Philadelphia.
Norovirus, the nasty stomach bug, is also spreading. 91 outbreaks were reported early in December, according to the CDC.